begin with the cardiology problem set. We'll start with question number 5, which is essentially first question. I have Ian with his hands up. If you want to unmute yourself, read the question.
All right. Which of the following statements about blood is false? I put B. Normal pH is 6.8 to 7.
That is correct. That's false. The normal, do you know what's the normal range for blood pH?
Well, the body is 7.4, right?
Yeah, so the range would be 735, 745. If you are above this number, you're going to be towards alkaline side. If you are below this number, you'll be towards the acidic side. Easy way to remember these numbers, if you remember your Untitled CO2 is 3545, right? You just add the 7 in front of it, this EtCO2. So just add 7 in front of it, that's your blood pH level. And what you said, Ian, 7.4 would be like right in the middle. So that would be the midline. But anything between 735, 745, you're in the range. All right, good. Next, I have Aaron for number 11.
The total volume of blood in the body of an adult male is approximately, I want to say C, 5 to 6.
Yeah, C is correct. Do you remember the formula that we used to determine cardiac output?
Cardiac output is heart rate times, I just need a second. Is it peripheral vascular resistance?
That would be blood pressure, but heart rate times stroke volume, right? And
stroke volume.
Yeah, so heart rate, we usually said about 70 beats per minute. Mm-hmm. And the stroke volume was about 70 mLs, right? And when you multiply these two numbers, you get 4,900, right, ml, which converts to 4.9 liters. So it makes sense, right? If your cardiac output is at this level, at the resting state, right, your blood volume should match. Why? Because that's what you're, circulating, right? So your normal cardiac your normal volume is roughly 5 to 6 liters, right? Should match your cardiac output, right? So that makes sense. All right. Next, we go to Ari for number 12.
Awesome. Happy New Year, Nikolai.
Thank you.
Which organ secretes most of the plasma proteins? Plasma proteins is going to be the liver.
Liver is correct, right? Yeah. So for your clotting protein specifically, we talked about in the cardiovascular chapter, liver is your main player. Very good. We go to Helmi for 16.
The plasma protein is essential for blood coagulation. Plasma will be fibrinogen.
Fibrinogen is correct, right? Yeah, fibrinogen is correct. So when we make that final blood clot, right, we make prothrombin into fibrin and then fibrinogen into fibrin. And fibrin is that final layer that basically cements, and by the way, right, in the hospital, if you want to lyse that fibrin clot, right, if the patient comes in and they have that thrombus, they give them TPA, tissue plasminogen activator, right, to lyse that fibrin clot. So prothrombin into thrombin, then converts fibrinogen into fibrin, the active deposition, that what makes that clot. And then to lyse it, right, if they were going to give them lytics, right, fibrinolytics, they would give them basically TPA to basically lyse that fibrin clot. Good. 27, we're going to go to Eric.
The normal pH of blood is A, slightly alkaline.
Yeah, that is correct, right? We just said it was 7.4, which is towards the alkaline side, right? So yeah, right. If you were gonna go, use the pH scale, right? We know 7 point. So the scale ranges right from 0 to 14. 7 would be right in the middle, but because blood is 7.4, it's towards the alkaline side. So very good. 8 is correct. Okay, we're gonna go to number 28. I'm going to start back, I think, since no one else is raising their hands. We're gonna go back to Ian.
All right. Red blood cell production is regulated by the hormone erythropoietin. I don't know how to pronounce this.
Erythropoietin, right? Erythropoietin. Yeah, and that is correct. C is the correct answer. Yeah. So
yeah, it's produced in the kidneys.
Yeah, those patients who have chronic kidney problems and they're on dialysis, right? They do not make erythropoietin, so they give them synthetic erythropoietin, so they could, produce, that red blood cells with erythropoietin because their kidneys are not functioning as well. So very good. We're going to go to number 45. We're going to go to Aaron.
Sorry, 45. Transports oxygen and CO2 in the red blood cells. I want to say D, hemoglobin molecule.
Yeah. Hemoglobin is correct. We talked about, right, specifically, it has pockets of iron, right, where it binds heme, right? The iron binds oxygen, and so that's what's going to be transporting oxygen. Very good. So we're gonna go to 47. We got Eric for number 47.
All right, the function of red blood cells is to carry oxygen from the body cells to the lungs.
So this question is, you got to be careful, right? So does your red blood cells carry oxygen from the body to the lungs, or it carries from the lungs to the body cells?
Vice versa, the lungs to the body cells.
Yeah, that B is the correct. So be careful when you read these questions because oxygen gets loaded in the lungs, right? Not in the body cells. It comes in the lungs and then it gets delivered to the body cells. So B for number 47 is the correct choice. Okay, we're gonna go 48. We got Helmi for 48.
More than 95% of the protein in red blood cell is 90% protein in red blood cells is hemoglobin.
Hemoglobin is correct. Yeah, hemoglobin is correct. We said basically red blood cells are bags of hemoglobin whose job is primarily to transport oxygen to the tissues. Good. We're gonna go to who we got next. We got Musab for number 51.
Each hemiring in hemoglobin encloses an atom of iron.
Iron is correct, right? Yeah, that's basically where we get the heme from, right? Iron is the very good. 54. We got. I don't know if you guys hands came down after a little while, so I only see 3 people who have their hands raised. So I'm gonna go back to Ian.
Oh, I'll go.
Go ahead. Go ahead. 54.
RBCs typically live about 120 days. The main reason for this short lifespan in the RBCs is their D.
Yeah, lack of nucleus. Red blood cells are, cells that don't have a nucleus, and also, right, they lack mitochondria. So red blood cells, because of that, their lifespan is 120 days, and because they lack mitochondria, they can only do anaerobic glycolysis. They cannot send, they cannot transport the rest of it to electron transport chain. So that's why, and for their metabolic needs, that's all they need. So lack of nucleus, lack of mitochondria, which you want to remember about RBCs. All right. 55. I have Andrew for number 55.
55. All the circulating red blood cells originate in the red blood cells. That would be the red bone marrow.
Red bone marrow is correct, right? That's where they are produced, right? That's good. 56. We're gonna go to let's see who we got. We have Syed for number 56.
Wait, Nick?
Yes.
Would the answer be E as well, or?
Red blood cells, they're not made in the lymph tissue. Lymph tissue usually have lymphocytes in them, right? And that's basically they have the uptake of like a plasma, right? That's gets secreted in the capillaries, right? So red bone marrow is what basically makes red blood cells, right? Progenitor cells, specifically the stem cells in the bone marrow. The lymph does not make that. We're going to talk about more of that in depth about that today. All right. 56, I think I said Syed.
Yes.
Okay.
The average lifespan of a red blood cell is 4 months.
Yeah, we just saw that, right? 120 days roughly. Good. Next, we're gonna go to John for number 91.
Platelets function in all of all of the following except this is C.
Contracting after clot formation. They do contract after clot formation because you have to basically make that clot smaller,
sorry.
right?
This would be A, right?
A, correct. Yeah, platelets, their job is to plug up the hole. Their job is not to dissolve, right? Dissolve the formed clot. What dissolves the formed clot is like lytics, right? Plasmin. We make some of that. We do make clots in your body normally, right? And your body breaks them down. You don't die from it if they're small enough. And plasmin lyses those clots. And platelets' function is definitely not to dissolve those clots. All right, number 92, we're going to go to Crystal.
Blank involves a cascade of reactions leading to the conversion of fibrinogen to fibrin. It is D.
D is correct, yeah. The process of coagulation, right? That's the cascade process. Good. 93, we're going to go to, let's go back to Ian.
The conversion of fibrinogen to fibrin is catalyzed by D, thrombin.
Thrombin is correct. Yes, that is correct. Right. So if you look at the chart, that's the formation. Fibrinogen into fibrin is catalyzed by thrombin, which is prothrombin is converted to thrombin, and all of these clotting proteins are made in the liver. Right. So you guys remember. 97. We're gonna go to Aaron.
The process of fibrinolysis.
So remember, this lysis means to break, right?
Yeah. I don't want to say C.
Yeah, that is correct. C
is C?
Yeah. So when you fibrinolyze, right, you dissolve the clot. So that's why like you bring a patient who has a STEMI, ST segment elevation MI, or you bring a patient who has a CVA and they have possible clot, right? In the hospital, if they cannot send them fast enough to the thrombectomy center or STEMI center, they're going to give them lytics, right? Fibrinolytics. So the reason why they call it fibrinolytics is because they cause fibrinolysis. They break those clots apart. So, okay, good. 98, we're going to go to Kiara.
The enzyme that can digest fibrin and dissolve a clot is D.
So the actual enzyme is plasmin, right? We just spoke about it several times.
Mm-hmm.
So the actual enzyme that will digest the fibrin clot is plasmin, right? And that's why the reason why they call TPA, right? Tissue plasminogen activator. So I want plasminogen, I want to activate, I want to make it into plasmin so that I can dissolve the clot, right? TPA is what's given to those patients who have clotting problems like CVA, STEMI, right? They come in to the hospital. Okay. Number 103, we're going to go to Helmi.
Which of the following vitamin is needed for formation of clotting factor? Is vitamin K C?
Yeah, that is correct. Yeah. So vitamin K is what's needed, right? Choice number C for vitamin K for clotting. Remember K for clotting. I know it's not spelled with a K, but as long as you remember clotting spelled with a K, you'll remember it's vitamin K for your exams. Okay. So next we're going to continue with the same questions. Its cardiovascular function starts with question number 1, and let's go with Syed.
The superior portion of the heart where major blood vessels enter and exit is the base.
The base is correct, right? So when we draw the heart, right, this spot was the base. this was, right, the apex. So then now question number 2, let's go to Eric.
The inferior point of the heart is called B, apex.
Apex, right? And remember, if you're putting a stethoscope there, we were getting apical pulse, right? And that's why that's why they call that the apex point. Good. Number 5, let's do Aaron.
Which of the following descriptions match the phrase near the left fifth intercostal space? That will be I guess C, apex of the heart.
Yeah, apex. Remember that essentially where we auscultate the apical pulse. That's also right. If you want to auscultate for your heart sounds, right, lub-dub sounds. If I want to hear any abnormal sounds, if I believe there's a prolapsed valve, that's where I'm going to go. Fifth intercostal space, mid-clavicular line, right? So this is called apex of the heart. Number 7, let's see who we have. Crystal, number 7.
The cavity that contains only the heart is the pericardial cavity.
Yeah, pericardial cavity is correct. Right, so we have different cavities. We're going to go through them, right? So the one that contains only the heart is the pericardial cavity. For number 8, we're going to go with, let's see, you guys, if you want to raise your hands, otherwise we're going to start back with Ian. Ian, go ahead.
The entire space between the pleural cavities containing only the heart, great vessels, thymus, trachea, and esophagus is called the B, mediastinum.
Mediastinum is the correct, right? And because if you notice, right, it has all the great vessels. When they say the great vessels, they usually mean the aorta. They also mean, right, the vena cava. And specifically, right, when we learned in the cardiac chapter, if you have widened mediastinum, right, they will call it widened mediastinum, especially if they see the chest x-ray. That's usually a sign of aortic dissection. So if you see a widened mediastinum, you should right away suspect possible aortic dissection. Check the peripheral pulses, compare, right, upper extremities to the lower extremities, see if your patient exhibiting any signs of, CVA types symptoms, weakness on one side. And you definitely want to assess blood pressures in, different in both arms. If you have the sized cuff for the legs, you could even do that as well, right? And if you have big gap, like big wide margins, let's say one arm's blood pressure is like 190 over 100, and the other arm is like 100 over 80 or 90 over 80, right? Definitely something is abnormal. So suspect possible aortic dissection there. Good. Number 9, let's go with Helmi.
The cavity that contains the lungs, the heart, great vessels, thymus, the esophagus, the trachea is the mediastinum, 2C.
So this cavity is more extensive. You notice, right? They start to include
then thoracic cavity. Yeah. Sorry, I didn't see
yeah.
thoracic cavity. Yeah, sorry.
Yeah, it's thoracic cavity, and the reason why is that the moment so what's the subdivision, right? So the mediastinum is like, think of it as the middle box, right? Sometimes they call the chest box, right? When they're talking about the surgery, and when you talk about the thoracic cavity, right, it includes, you see the lungs, so it's more, right, expanded. So you have more structures there. So there's pretty much thoracic cavity is all the stuff there: lungs, great vessels, right, the heart, the esophagus, all that. All right. Number 10, we're going to go with Syed.
The term used to describe fluid collecting in the pericardial cavity restricts the movement of the heart is known as cardiac tamponade.
Yeah. So this question is a poor question, to be quite honest with you. That should be called pleural effusion, right? So it says restricts movement of the heart. It's not until the patient starts to develop the signs of Beck's triad, right? When they have hypotension, muffled heart sounds, right? Narrowing pulse pressures. So when you start to see those signs and symptoms, then it's transition from effusion to the tamponade. But this, for this one, they say that A is correct answer, even though that's not truly a good definition for it. So the fluid collecting is that restricts the movement is still going to be pleural effusion, but the moment it transitions to basically tamponade is usually it's an obstructive shock. So the moment you switch to an obstructive shock, patient should be symptomatic, right? Symptomatic for what? So backstrad, if you remember those signs, that's when you say, okay, that's transition to the tamponade. All right. By the way, anyone know what's the treatment for that? What's the treatment for cardiac tamponade?
Lasix.
What is it?
Lasix.
Lasix?
I don't know.
Lasix. Lasix will not really
Cardiocenthesis.
Pericardial synthesis. Who said? Helmi said it. Yeah. So pericardial synthesis, basically, they use a syringe. They put a needle into that pericardial sac, and they're going to aspirate that fluid or the blood or whatever the content is. Sometimes the problem may be that the blood congeals, right? The moment blood leaves its vessel or it leaves the circulatory components of the heart, it starts to clot. So if it's blood that's there, secondary to trauma, let's say somebody got stabbed, right? And the blood congeals and clots, you wouldn't be able to just evacuate it with aspiration. So those patients may need some surgical interventions as well, right? But usually, right, if it's fluid, then yeah, they could aspirate it with a syringe, and you see a dramatic improvement with the for the patient. I've seen as much as 250, even 300 mLs removed, and you see dramatic hemodynamic improvement in the patient status. It's not part of the paramedic skill set, but if you're ever in the hospital, you might be able to see it. They perform it. All right. Number 12, we're going to go with Aaron.
All right. Intercalated discs serve to transfer all the following from cell to cell except dang. I'm gonna go with the force of contraction.
So they do propagate that, and they allow the force of contraction by allowing conduction from cell to cell. What they do not do is the Z lines, right? So intercalated discs, they basically found, I think I showed you diagrams of myocytes where you see them, and they have desmosomes. They basically anchor cells together, right? And they also have gap junctions, which facilitate ion flow, ion movement, right? Sodium, calcium, potassium movement. So all of those things are there, right? The only ones they don't have is the Z lines. All right, number 13, we're gonna go with Mike Kwan.
Number 13, right?
Number 13, yeah. Let me move it up.
All right, the muscle layer of the heart is the myocardium.
Myocardium is correct, right? It's the biggest layer. The other layers, right? If we go from inside out, it would be endocardium, then it would be the myocardium, the muscle layer, and then the epicardium, surrounded by the pericardial sac. So this is the inner, middle, outer, and then the sac is the final layer that's surrounding it. But for this one, B is the choice. 14, we're gonna go with Eric.
All right. The blank lines, the chambers of the heart, covers the heart valves and is continuous with the endothelium. Put C, endocardium.
C is correct. Endocardium, right, is the inner layer, and that's what basically is in contact with blood as well, right? So endocardium is there. One thing I was explaining to you guys, right? Let's say this is your heart, and we see the layers, right? So let me just do this and make a couple of layers. We're gonna say the purple is the endocardium, and let's say the orange is the myocardium, and then let's do blue is the epicardium, right? And then I'm gonna draw like a coronary artery that basically goes inside and feeds all these, right? walls. So if you start to have a thrombus here, right? So the blood can come until this point, but it cannot travel distally. So it cannot feed further down. So the first places of injury that you're going to see is here. This is where the area of the heart is going to start to become ischemic. So in the endocardium is the first portion of the heart that shows you ischemia. So ischemia is usually seen by ST segment depression, T-wave inversion, right? But as the time progresses and this clot is there, right, and it still not allows further blood movement, this area starts to expand. So it starts to go from endocardium to myocardium. And as this moves, we call this as a transmural MI because it starts to bypass these walls, right? And as it progresses and the bigger it becomes, right, the zone of necrosis expands. And if you don't intervene and it goes past your myocardium, you basically lose viable tissue that's able to contract. And if it's on the left ventricle, that's, they can sustain cardiogenic shock and, could have dire consequences because of that. But usually MIs, right, progress from endocardium and they make their way, through those muscle layers. And once they do, right, the moment they bypasses the first layer, we basically call it transmural MI. All right, number 21, we're going to go with Lindsay.
Blood is supplied to the myocardium by the coronary artery.
Yeah, coronary arteries is correct. I would, out of all the stuff you guys need to know, right, I would definitely know the major ones. Lindsay, do you recall what are the major coronary arteries that you need to know?
There's the, I forget the name. One on the right and one on the, like a left one that branches. Right?
Yeah, so if it's on the right, what would you call it?
The right descending artery?
Right coronary artery,
right coronary
RCA,
artery.
right? And then the left coronary artery. But the left has two subdivisions, right? The left coronary artery is the circumflex, which feeds the lateral side of the heart. And then you have the left anterior descending, which basically feeds the septal wall. It feeds the anterior wall, right, of the left ventricle. These coronary arteries, you definitely should know where they are located because a lot of your totally ECG interpretation will focus on these coronary arteries, right? So it's a good idea to know where they are, what they feed, right? And what are where on the total EKG we could see those specific changes associated with these coronary arteries, right? Number 22, we're gonna go with let's see. So we're back to Ian.
The first blood vessels to branch from the aorta are the coronary arteries.
Yeah. And by the way, when do they get fat? During systole or diastole?
During diastole.
Diastole is good. Okay. 23, we're going to go with Helmi.
The marginal branch and the posterior interventricular branch are branches of right coronary artery.
Yeah, right coronary artery is correct, right? So they feed the right ventricle. They also feed the posterior wall, right, of the heart, and they feed the inferior wall of the heart. Also, good thing to remember, right coronary artery also supplies blood supply to the SA node and the AV node. So if you see someone who's having a heart attack, right, I should say a STEMI, right, and you see that his right coronary artery is involved, usually it's indicative by 2-3 AVF elevations, right, ST segment elevation. Take a note of the heart. If you also see a bradycardia associated with it, it could be that his SA node took a hit, so your lesion may be proximally higher up, right? Yeah, you would not know for sure until you take the person to the cath lab, but something to suspect, right? If heart rate is not 60 to 100, right, it's below that, maybe heart rate is 40, right? And they have a STEMI, 2-3 AVF elevations, right coronary artery is involved, perhaps SA node took a hit, and your lesion is proximal, right, to the SA. 24, we're going to go with Syed.
The circumflex branch of the anterior intraventricular artery are branches of the, I believe it was the right coronary artery. No, left coronary artery.
Are you sure?
Yes, left.
All right, it is left, right? So we just said, right? So we said the left coronary was the circumflex and the left anterior descending, right? So the circumflex branch and the anterior LAD, they are definitely left coronary artery. By the way, left coronary artery, if it's proximally thrombosed, right? If there's a thrombus higher up, you take out the entire left ventricle. Those are cases of severe cardiogenic shock because they have left ventricular pump failure, right? They will need a lot of support, usually in the hospital. They get placed on a balloon pump, right? That's the device that will help them to get more blood flow to the coronary arteries. But those patients will have, those are the patients you will see, right? With very, very low blood pressures. Oftentimes they will go into cardiac arrest if they have massive LV infarction. So left branch, right, has the circumflex and the LAD. Okay, 25, we're going to go to, let's see, Mike Wan.
The great and middle cardiac veins drain into the cardiac veins. I'm lost.
Okay. So in the lecture I was showing you a picture. There's basically a coronary sinus on the heart, right?
Mhm.
So that's where they return, and then they go back to the left atria, right? They go back to the right atria. Why? Because the right atria then is going to go to right ventricle, and then it's going to go to the lungs to get oxygenated. So
Okay.
they're gonna go to the coronary sinus, and then they're gonna proceed to the right atria, right ventricle, to the lungs to get oxygenated. Basically, what this is that we have coronary arteries that supply blood and nutrients to the heart muscle, right? And then we also have the veins that basically take that blood that has to be reoxygenated, has to circle back through the lungs, and it does that via the coronary sinus drainage. Okay, 26. We're gonna go to Eric.
All right. The blank delivers blood to the myocardium. I put D, left coronary artery.
So when you have questions like this, right? So when they say myocardium, they mean the entire heart, right? So if you have a question like this, you have to look at the choices, right? If a choice includes another choice, right? Before you eliminate it, think if it applies, right? So you said left coronary. What about the right coronary? Does it feed the myocardium too?
Yeah.
Yeah. And so left and right coronaries, they both feed the heart, right? So for completeness, right, E would be the best choice here, right? Why? Because the other ones, right, we could say right feeds it, right, left feeds it. So choice E includes both. So that would be the best answer. If the question said which of these deliver blood to, let's say, the right ventricle, or I would say which of these deliver blood to the septal wall, then your choices might differ. But the moment they say myocardium, they basically mean the entire heart. All right, 27. We're gonna go. Let's see who we have. Luisa, is your hand raised? If it is, you can go for 27.
Yes. 27. Blood is supplied to the left atrium by the C, left coronary artery.
That is correct, right? So left atrium, left coronary, right? Basically everything that's on the left side, yeah, will be supplied by the left coronary artery, right? Very good. 28. We're gonna go back to Ian.
Coronary veins empty into the, I put right atrium.
Right atrium is correct, right? We just went over this, right? So here, right, the coronary sinus and the veins, right? So basically the reason why they go into right atrium is because then they have to go to the right ventricle, and then they have to go to the lungs for the oxygen, right? And then they're going to go to the left atria and so forth. But yeah, right atrium is correct. Number 29, we're going to go to Syed. Oh, sorry, Helmi is next.
Blood returning to the heart from the systemic circuits first enter the left ventricle, left atrium, right Yeah. Right atrium.
Right atrium is correct.
Followed by
Yes.
superior and inferior vena cava.
Yeah. 29 is right atrium, right? Because we, when they say systemic circuit, they're basically saying blood is coming from inferior superior vena cava, and it's going to go into the right atrium first. That's correct. Number 30, we're going to go with Syed.
Blood returning to the heart from the pulmonary circuit first enters the left atrium.
Left atrium, right, is good. And then it's going to go systemically. Number 33, we have Lindsay.
The cusps leaflets of atrioventricular valves attached directly to C, the chordae tendineae.
That is correct, right? And that's, by the way, that chordae tendineae can snap in certain MIs, so that's why we listen to the heart sounds, right? If you hear abnormal heart sounds in the setting of a heart attack, it's possible that you have papillary muscle rupture, and you have basically chordae tendineae that's now no longer holding these cusps of these AV valves. So you may have abnormal sounds. So always in the setting of an MI, UCSD segment elevation, auscultate fifth intercostal space, mid-clavicular line. Help me out. You have a question? Or are you just raising your hands to do more questions?
Question.
You have a question? Go ahead.
Okay, this is for the chordae tendineae. This is like associated with regurgitance, right? Like,
yeah, yes,
and you hear murmurs. That's correct.
Yeah, you may hear regurgitant sound. Usually, if it happens on the left side, that's the mitral valve that becomes regurgitant. Yes, and you may hear also, in addition to abnormal heart sounds, you may hear pulmonary edema, right, or fluids in the lungs. Why? Because now you have the backflow, right, that's going back and accumulating there. So always in the setting of a heart attack, always listen to the heart sounds and lung sounds.
Thank you.
Yeah. 34. We have Eric for 34.
34. The right ventricle pumps blood to the left atrium. See?
So the right ventricle pumps blood to before you could pump to the where else can you pump blood to?
The aorta.
So let me draw like a schematic here, right? So you have the right atria, the right ventricle.
Oh, I was looking at it wrong.
Left atria and the left ventricle, right? So
the right and left
from the inferior and superior vena cava, when the blood comes in, it first comes in into the right atria, right? Then there is a valve here, right? Tricuspid valve. Blood goes into the right ventricle. Before the blood can go into the left atrium, blood has to go where?
The pulmonary artery.
Yeah, pulmonary artery. So basically, it's going to go to right and left lung.
Yeah. Okay.
So be careful in questions like this. I know when you take your state exam, they definitely like questions like this, asking you blood flow through the heart. So you must be expert knowing the valves, knowing the order of flow, right? Knowing if there's a backup, like, if there's a left ventricular failure or there's a valve problem, where the blood is going to back up into, right? So like if I told you, let's say there's right ventricular failure and the right ventricle is not pumping, where do you suspect blood is going to be backed up to? Where would you see, the backup?
On the right atrium.
And what else?
The valves?
Where on the body you may see the backup of blood? Eric, you wanna go?
Jugular veins.
Yeah. So if you have a right ventricular failure, right, the right ventricle is not moving blood towards the lungs, you have a backup. So this was your superior vena cava, this was your inferior vena cava. So you will see, right, your blood pooling, right, where jugular venous distension, right, you'll have pedal edema, right? If it happened, let's say on the left ventricle is not functional, you will have pulmonary edema, right? So definitely know where the blood can back up to where you see the signs and symptoms, and certainly know the normal, blood flow through your heart and through your lungs, and pulmonary versus systemic circulation. That's what I wanted to say. Okay, number 35. We're gonna go with Crystal.
The left ventricle pumps blood to the aorta.
Aorta is correct. Very good. 36. We're back to Ian.
The right atrium receives blood from all of the following except the pulmonary veins. D.
Yeah, that is correct. Which part of the heart receives blood from the pulmonary veins?
This would be the left atrium.
Left atria is correct, right? And there is 4 pulmonary veins, which is connected to the left atria. And by the way, the pulmonary veins carries oxygenated blood, right? Which is different from your other veins, which carry deoxygenated blood. So remember, pulmonary veins, oxygenated blood, and they go to the left atria, right? There's 4 inputs to the left atria. All right, 41, we are up to Helmi.
The following is a list of vessels and structures that are associated with the heart. This is no question.
The question is the question is right below it.
Okay. Okay. What is the correct order of the following blood entering the systemic circulation? What the correct order of the flow of blood entering the systemic circulation? Okay.
So with these questions, I will give you a tip. What you want to do is you want to look at the choices, right, and identify what has to be number 1. The moment you identify what has to be number 1, you could already eliminate some of the choices.
And 6 is number. Which of the correct order of the flow of the blood entering the from system? Okay. Okay, right. I'm right. Okay, right. Atrium. Then vena cava number 5 is vena cava is vena cava. Then we're gonna take out number A, B, and EB, and okay. And then right atrium, right atrium, right ventricle, right atrium, right atrium. Then number 1, we're gonna take number 1.
Okay. So then you said
will
number
be
1.
C.
So
we're gonna take number D out. We're gonna take number D out.
Okay.
Then okay. Right atrium, right ventricle. Then 3.
Yeah.
Then will be number E, and the same.
Be careful because C and E are the same so far.
Same. Yes.
Yeah.
So, ventricle, then pulmonary vein. Then 7 will be number C.
Yeah, correct.
Then C is the correct answer.
Yeah. So basically, yes, correct. That is a good strategy to do it, right? So first find what's going to be first. So vena cava is going to be certainly number 1. So we said superior, inferior vena cava, and then look at your choices, right? And right away we could eliminate A and B, right? So always do that, and then based on that, just continue the process and eliminate as you find. So for this one, C is the correct choice. You should definitely know the flow of blood, right? That's why I put so many questions on this. Definitely know the valves. Definitely know the sequence, right? And definitely know if there's a blockage or a problem with a certain aspect, like the valve or the actual chamber of the heart, what's going to be the consequences of that. So that is definitely an important thing to know. Okay, 42, we're going to go with Syed.
The pulmonary arteries carry blood to the arteries. The heart?
So
yeah, the heart.
So the pulmonary arteries, right?
Oh, away from the heart, so the lungs.
The lungs is correct. Yeah. So be careful with questions like this, right? So the pulmonary arteries carry deoxygenated blood to the lungs to get oxygenated, right? Then we're gonna go to Lindsay for number 43.
The pulmonary veins carry blood to the heart.
To the heart is correct, right? Specifically, if we asked you out of these choices, heart is the correct answer. But if you want to be very specific, it's going to be the left atria. Right? But heart is the correct choice. Okay, now we're going to go with some identification. Number 44, we have Ari. Would you like to go? So this is
I'd
number
love to go.
19.
All right.
19 is, let's see where.
19. So that's coming out of the right ventricle. So that's going to be the, oh, that right there, that valve. That's what I'm saying. Oh, that's going to be the right. Oh man, what's it called? Oh, I got options here. Okay. The pulmonary semilunar valve.
Correct. So B is correct. Pulmonary semilunar valve. Pulmonary valve would also be the correct answer, right? Pulmonic valve is another choice. But yeah, so this is the right ventricle. This is where the blood is headed, right? So good. Number 45, we have, let's see, we got Aaron for number 45.
All right, identify the structure labeled 8.
8 is.
I need. Can you zoom in a little bit?
Yeah.
Oh, that was a lot of it. Okay. I know that's the chordae tendae above it. Going down. Can I see the options?
Yep.
Oh, I want to say it's gonna be. I think it's either C or D.
So what's directly connected to the chordae tendineae, right? You see how it's pointed specifically to this?
Yeah. Papillary muscles, I believe I heard you say.
Papillary muscles is correct for number 45, right? And this is why I was explaining to you guys, right? So these are the papillary muscles, these are the papillary muscles, and they are directly connected to the chordae tendineae, and the chordae tendineae is directly connected to the cusps of the valves. That's why when you have an infarct, right, and you have a blockage of, let's say, a coronary artery, let's say this is one of the coronary arteries is blocked that's supplying blood flow here, right? And it's also supplying to the endocardium, obviously, right? But if this papillary muscles stops receiving blood flow, right, it's going to infarct the same way. And it may, with a strong contraction, right, this may shear. So then you have a prolapsed valve. And this is why in the setting of an MI, right, if you have abnormal heart sounds, always be, on the lookout that there's possibly, papillary muscle rupture. And, there might be also pulmonary edema, right? So listen to the heart sounds, listen to the lung sounds. So that's why we were specifically speaking about that. All right, number 46. We're gonna go with Mike Juan for 46.
All right, 46. Identify the structure. Label 6. All right, can I see it?
Yeah, let me delete all this. The 6 is pointing.
Can I see my option?
Yep.
Well, that's the right side, so it's not. I don't want to guess the wrong one. A
is correct, right? So it's on here, right? This is the tricuspid valve, right? And it's pointing to one of the cusps. So this is the tricuspid. This is the mitral side. Or bicuspid side, right? So yeah, 46 is A is the correct choice. All right, 56. We are gonna go with Aaron.
All right, contractions of the papillary muscles. I want to say eject blood from the atria into, yeah, I want to say E. Eject blood.
So remember, we just talked about, right? What happens when you have a papillary muscle rupture? We have, right? We have backflow of blood, right? So, so if we have a backflow of blood, their purpose is to prevent that backflow of blood. So what the contraction of papillary muscles does is when these muscles tense up, right? When these muscles contract, they basically make these chordae tendineae taut. They make them tight. And what does that do, right? That prevents the atrioventricular valves from reversing into the atria. So basically, they prevent the backflow of blood. So 56 D is the correct choice here. All right, we're back to Ian for 57.
The pulmonary semilunar valve prevents backward flow into the right ventricle. D.
57, you said D? Yeah, the pulmonary semilunar valves prevent backflow into the right ventricle, yeah. And essentially, we know that the way blood moves is it moves via, right, changes in pressure. So what that means is that, right, you see how it says the pulmonary semilunar valves prevent backflow into the right ventricle. So if you look at this diagram, right, so let's say blood comes in through here, right, and as this ventricle is filling up, the moment the pressure here, right, the moment the pressure here exceeds the pressure in here in the atria, these valves shut, right? Then the ventricle starts to contract, is going to push the blood into the pulmonic trunk, right? And then the moment it pushes the blood here, initially the pressure is high, right? As the blood is being ejected. After some time, this stream is not going to be as strong. So the stream will start to diminish. And when it diminishes, is going to come a point where pressure here, right, is going to be versus here, right, the pressure drops. So these valves have to shut so that there's no backflow. So all of this is determined by pressures, the pressure gradient in these valves. Or these chambers, I should say. That would be a better way of saying it. So 57D is the correct choice. All right, let's do 58. Let's do Helmi.
The bicuspid or mitral valve is located in the opening of the between the left atrium and the left ventricle. E.
Yeah, good. It's the mighty valve, so it's on the left side. All right. So it's good. Number 60. We're gonna go with Syed.
Rupture of the papillary muscles in the left ventricle may result in any of the following except bicuspid regurgitation, pulmonary valve stenosis. I'm gonna say pulmonary valve stenosis.
Correct, right? Because pulmonary valve is on the right side, right, from the right ventricle, and here they're just trying to trick you, right? Mitral versus bicuspid. That's the name of the same exact valve, right? Remember? Anyone recall where the term mitral came from?
Pope's hat.
Yeah, Pope's hat, right? So he has this type of hat. It's they call it the mitre, right? Or the cardinal's hat, right? So that's where they got the mitral from. But the other term is bicuspid. So don't get confused about the names, right? So all this is basically it means the same exact thing. So E is the correct choice here. Number 60, we're gonna go. 61. 61, we're gonna go with Lindsay.
When the semilunar valves close, the AV valves then open. B.
B, right? So yeah, so when the semi valves close, AV valves open. So it's all pressure gradients, right? Semilunar valves close, AV open, so that we have a filling of the ventricles, right ventricle, left ventricle. So everything is a pressure gradient here. 62. Let's go. We're gonna go back to Ian.
If a patient's tricuspid valve was leaking during systole, what would happen? I put a regurgitation back into the right atrium.
Yeah, that is correct. So tricuspid valve is leaking, right? So the tricuspid valve is on the right side, and you'll have regurg from back into the right atrium. So from the right ventricle to the right atrium. Why? Because, let me just go back to this diagram, right? This is the valve that is problematic. So this is the tricuspid valve, right, that they drew here with the cusps. So basically blood is going to go this way. Good. 63, we have Helmi.
A patient suffers from a prolapsed mitral valve. The condition would cause effort by right ventricle, increase effort by left ventricle. I think that will be C.
So you may have regurgitation, but out of these, is there a better answer?
Yeah, D will be D. Increase the effort by increase the effort by left ventricle and regurgitation.
Yeah, because remember, mitral valve is on the mighty side. Mighty side is the left side. So increased efforts of the left ventricle and regurgitation. So look at your choices. If you see how they have increased effort and here they have regurg. If one choice has both of them, think about if it applies. If it applies, employ that choice, right? Let's do one more and then we'll take a break. Let's go with Syed for number 69.
As the heart rate slows, blank gets longer. I'm going to say diastole.
Yeah, diastole gets longer, right? That's why this was a very important aspect when someone suffers from tachydysrhythmia, right? Anyone who has a tachydysrhythmia, like a fast heartbeat, tachycardia, right? Their diastolic phase, when the heart fills, slows down. It's less. So they have less preload coming in. That's why those patients can syncope. If you learn about, let's say, supraventricular tachycardia, right? They are beating so fast, it's about 150. Their diastole is reduced. So they can syncope because the heart is so fast it cannot fill. So that's good, right? So let's stop. We're going to stop here